Hello, good evening. How you doing? Happy Sunday to you. The time is 8 p.m. here in Nigeria. Welcome to Ask the Doctors. This is a program that holds every Sunday by 8 p.m. Nigerian time. My name is Dr. Frederick Unmibohai, and I'm the host of this program. My co-host is Dr. Israel Robonose. Now, on today's program, we'll be talking briefly about malaria, myths or myth versus facts, misconceptions versus the true information. But before we start, I want you to tell me, where are you watching me from? How are you? And tell me, where are you watching me from? I'm live on Facebook. I'm also live on YouTube. I'm equally live on TikTok. Let's see. Let's see if we can keep the live session for those who are on TikTok. Abby, let's try. And let's do that for today. Huh? Okay. So how are you? And tell me, where are you watching me from? Let's talk about malaria today. Myths versus facts. Now, 2 days ago was World Malaria Day. Yes, was a World Malaria Day. And I was surprised when I asked a lot of people to ask me any question concerning malaria. The questions were shocking. So I decided, oh my god, I speak Igbo, sorry. So I can't decide, say, make we make we talk about malaria. Yeah, I decided we'll talk about malaria today on the program. But before we start, if you can hear me, I believe you did hear me, I'll be ahead. Tell me where you did watch me from. Roots, good evening, watching from Lagos. Okay, Roots on Facebook is watching me from Lagos. Okay. Hey, the double doctor watching from the nation's capital. I greet you specially, sir. How you doing now? Happy Sunday. Happy Sunday. I hope you can hear me loud and clear. How is the sound? How is the sound? Is it very clear? Please let me know. I'm not using my earpiece today. Huh? Yes. Because if I go live, Dr. Israel joins, people on TikTok will not hear. So I want to see if they can hear. Yes. Okay. Happy Sunday to you. Good evening, sir. Yes, yes. Good evening. Good evening. So let's talk briefly about malaria, myth versus facts. Now, if you're watching me right now, I want you to tell me, what do you know about malaria? I will tell you that malaria is among the top killers globally and is of severe public health concern. That is, it dey affect us for our mind. That's something wey we need to talk about. But many people still no know about malaria. So I want I want you to tell me what you understand, what you know by malaria. I am here as well following. Okay, the sound is good. Okay, that's nice. From Anambra State. Oshe, let me see. Network. Yes, I can hear you. Happy Sunday. Okay, very good, very good. We are live on Facebook and YouTube, and then people on TikTok. No, we just be on live for them. But what do you understand by the word malaria? Somebody says malaria is caused mainly by mosquito bites. Hmm. Essay on YouTube says malaria is mostly caused by mosquito bites. What is malaria? What do you understand? Tell me now. Why you dey form? Why you dey? Oh baby, follow me relate now. The sound is good. Okay, thank you very much. God bless you. Okay, but yeah, now I dey wait for you. Follow me talk. Follow me talk. Because I surprise the questions wey people dey ask me about malaria. Somebody ask me, say, doctor, if I enter sun, I dey get malaria. I say, no, that is not malaria. Because the only thing wey dey give malaria na mosquito. The bite of an infected. Oh yeah, listen, make I break am down. Wetin go make you get malaria? Na when mosquito bite you. This mosquito get the infected thing wey dey cause malaria inside, and na the female, the woman inside, female anopheles mosquito. So if the mosquito bite you, e come enter your body, na so you go take carry malaria. You dey hear me? Now when mosquito bite person, abeg, food no dey cause malaria. Okay, Dr. Israel is in the house. So when mosquito female, infected female anopheles mosquito e bite you, na so person dey take get malaria. You dey hear me so? Dr. Israel, if you are ready, give me a thumbs up. I'll bring you up. Yeah, yeah, give me thumbs up. I'll bring you up if you're ready. Okay. Okay, good, good, good. So, Dr. Israel, happy Sunday to you. How you dey?
I'm fine. Good evening. Happy Sunday to everybody. Happy Sunday to Dr. Fred.
Yeah, happy Sunday to you. Okay, so Matt, tell you before we continue, Dr. Israel. Today, I'm not using my earpiece so that the people on TikTok can hear you. I just want do one for them. Shey you get? The people on TikTok make dem fit hear you, because if I use my earpiece, dem no go hear you. Na only those of us wey dey Facebook and YouTube na im fit hear you. But the only thing wey TikTok go do for us na they must share. If dem no share, we fit just comot. So before you came up, I was asking people to tell me wetin dem know about malaria, wetin dem understand by malaria, and then I come break am down say malaria first of all na severe public health concern, because e still dey kpai people well well, and the thing be say e dey kpai people we know for developing nations, low and middle income countries, e dey kpai people. And na women wey get belle, children wey dey under 5, children wey dey less than 5 years old, na dem dey collect. I come talk say na mosquito dey give am. When the female mosquito, female anopheles wey carry am for body, when e bite person, na so person dey take carry am. So I want make you continue, then we'll come enter other areas of the discussion tonight. Over to you.
Okay, and Dr. Fred will give us a good introduction of malaria. Only the hospital now just talk about now the cause, which they really cause malaria. And so because as I dey talk, I go to talk many things they join am, just some few things. Now, yes, Dr. Fred say mosquito now they carry waiting the I think that's the right the waiting it talk or waiting some want to now they carry waiting they cause malaria. Now, not be all mosquito. First thing when you need to know, not be all mosquito. The mosquito where they carry are now female and no fairly.
I don't know if everybody dey hear you, but e dey break. So let me bring you back again, and then you continue. But e be dey break. Oh yeah, you are back. You are
Okay,
back.
I still they break.
Yeah, I see dey break small small.
You sure say now because now so your whole volume still be for my side, yeah. Oh, be like waiting they break for my side too.
Oh yeah, continue, continue.
Okay. So as I was saying, now female anopheles mosquito now they carry the waiting they cause malaria. So waiting they cause malaria now parasite. So now make we they call a malaria parasite. So now parasite now it be. And one family when they call plasmodium now it dey plasmodium species. So they get many species under that plasmodium family, but mainly the major ones where they quickly cause malaria for where they quickly cause malaria now there are like four. We have the Plasmodium falciparum, Plasmodium uveae, Plasmodium malariae, and Plasmodium vivas. So those are now be the major four where they quick cause malaria for this part of the world. But for the one where they more common for all of them, now be the Plasmodium falciparum. And and it dey affect a lot of persons. And Dr. Fred don give us the people where they really dey in danger if malaria affect them. Pregnant women, children wey dey less than 5 years and below, and even people wey dey place wey malaria no dey, they can't travel come place where malaria dey. So those kind of people they they see they are at risk of having malaria. So it's also good for us to know say malaria with sometimes we dey divide am into when I say into two, yeah, into two, we get into three. We get severe malaria. We get no two. We get severe malaria and malaria we not dey severe. So when we say malaria we dey severe, and the one wey feel say if they not quick handle am, if it cause death for that person, then the one wey be say if even dry the blood of the small pikin, if even cause heart failure for the small pikin or whoever gets the malaria. And the malaria wey be say people wey travel come from country where malaria no dey, come country where malaria dey or state where malaria dey. If e hold dem, na e fit we dey call am severe malaria. We get so many things wey we fit take classify severe malaria, but I don't think that's important for now, because if you go hospital, your doctor will always know whether this one is severe malaria or uncomplicated, not uncomplicated malaria. Yeah. So the one the other one and malaria where they affect everybody, when it can affect everybody, when not too dey severe. But another thing wey we need to know is that malaria dey endemic for this country. When we say something dey endemic, we mean say na malaria dey stay with us. Dey stay with us for Nigeria. Maybe this one na because the female anopheles mosquito dey everywhere and they carry this plasmodium species dey waka most of the time. So if the male anopheles mosquito bite you, you fit not actually you no go get malaria. But once the female touch you, and e get the plasmodium for your body, e go transfer am to the person, and then problem go start. So I think Dr. Fred, okay, before Dr. Fred come back, I don't know, we can just add this one to it again. And this one when I want to talk now, a little about the life cycle of malaria. This one why I want to talk this life cycle of malaria. This one because it go let you know why sometimes you go sick malaria today. You go think say you don't cover yourself, use cloth cover yourself. You don't pull net for window, pull net for door. You know they open anywhere. After 1 month, you surprise say you don still come down with malaria. The question now come be where that mosquito come for pass bite you, and in fact you even dey very very sure say mosquito sef no even touch you. So how come you come get malaria again? So na im make I will talk a little about the life cycle of malaria. So the life cycle of malaria dey follow two phase. One part of the life cycle dey happen for inside the female anopheles mosquito, while the other part dey happen for inside human being body. So I no need to mention the names, I no need to mention so many things. So I go just mention some few things about it. So that make we not confuse ourselves too much. Yeah. So the main thing wey make me want talk this one na just to explain why person fit get malaria even when the mosquito sef not bite the person. Now make I want talk this life cycle. If not be I don't think we need it. So when the female mosquito don bite person, e don transfer the garment into the person body. This garment go come separate. Dey come when they enter the body, the first place wey dem dey go na the liver. So when they get into the liver, dey come separate into two. They get one wey go dey inside the liver wey we dey call e dey dormant. When we say dormant, e no dey do anything, e just dey there. While the one wey go cause problem go come enter the bloodstream. So na that one wey enter the bloodstream na im dey make person dey know say im get malaria. While that one wey dey the liver go just dey there jejeje. So that one wey enter the bloodstream go come pass follow everywhere. If dem no kill am, come follow everywhere. If mosquito come bite the person again, that one go come enter the mosquito, go continue to dey grow for there. While that one wey dey the liver, if the person immune system come reduce small, that one wey dey the liver go come get up, come out. You come make the person get malaria again. So that one na wetin I just want make you understand. That's the reason why sometimes even when mosquito no bite you, you fit still come down with malaria. Dr. Fred. Dr. Fred. I beg, if anybody they hear me, just put on the comment section so you can hear me. And we still dey wait for Dr. Fred. Okay, Dr.
Yes,
Fred.
yes. How far? I don't come back. No verse. The network they try attack me, but I get Odeshi. Eh? Uh-huh. So we don't talk about wetin be malaria, talk about the types of malaria, talk wetin dey cause am. Eh? We can't talk about how it take dey happen when mosquito bite person. Wey be say as e bite you for body, when e bite you, e go pour something inside the person body. Then that thing wey e pour, e go run enter the liver, go for the person liver, e go plenty, born pikin multiply, go come out from the liver. You've explained that. Very good. But that is not for you online. Eh? We are not in the medical class. Now, when mosquito come bite person, e come enter liver, e come multiply, come spread go around the whole body. E go come give the person symptoms, plenty types of symptoms. And these symptoms, most times, there are other medical conditions that can give you this type of symptoms. But you no go know. Think say na only malaria get them. Shey you get the point? Now, before we talk about the symptoms, if you dey hear me, you dey understand wetin we talk about since, share this video, like and invite your friends. Share, like and invite. Share on Facebook, on YouTube, on TikTok, like and invite your friends. So what are the symptoms? Number one, your body fit dey hot. Wetin we dey call fever. That is increased body temperature. Remember, there are so many sicknesses that can give you increased body temperature.
Okay, Dr. Fred also disappeared, so I think I will continue. So we'll talk
Okay,
about
we
the
are back.
signs and
Am I
symptoms
back?
of
Yes, I'm
malaria.
back.
Okay, you don't come back.
Yes.
Okay, continue.
I don't come back. Oh, my
Yeah,
God is
welcome.
alive. So fever, body go dey catch person, cold go dey shake. Sometimes go get headache and body pains. Sometimes go tell you say, I can't eat. Doctor, I'm losing appetite. Sometimes you go feel like say you want vomit. Yes, because a lot of people think say when you dey vomit, oh na this sickness e be, oh na pregnancy. You can even vomit with malaria. You can have nausea, you can vomit, and then you can feel very weak. So I don talk some of the symptoms, so I go allow Dr. Israel make you talk about some other symptoms again wey we go need to look out for people wey get malaria. But remember, all the symptoms wey we mention for here, if you get am, we no talk say you get malaria. Oh, Dr. Israel, over to you. Oh, his network. Okay, I can hear you. Okay, very good. I'm hearing you. I can hear you. Okay, nice. You can hear me very good. So now there are some other kind of symptoms. Eh? Because remember, we spoke about severe malaria. Severe meaning say the malaria tie raba. This is not just ordinary. If you no do anything about am, you no go hospital, dem no confirm, you no collect treatment, it can be severe. It can affect the person for brain, which we dey call cerebral malaria. Person can develop convulsion, person fit dey get seizure. Yes, person body fit dey shake, fit get seizure, cerebral malaria. Okay, Dr. Israel is back. Yes. So Dr. Israel, I was talking about some of the severe. I started with cerebral. So please continue abeg.
Okay, so most of the symptoms now just as that most of the severe symptoms, most of them are just exaggeration of the normal symptoms. So you can get cerebral malaria, body temperature will be more than 40 degrees centigrade for most for children, 39 to 40 degrees centigrade for children. So some of them will come down with convulsion. The malaria fit cause convulsion. Now because because the malaria don't enter their body too much, it go fit even come dry their blood, so they'll come dey get anemia. And with that anemia, from there it can lead to anemic heart failure because blood not come many for the heart again. So it fit come dey cause anemic heart failure. So with some of them go come dey very lethargic, like they'll come be like say all their body don paralyze, very weak and and all that. So sometimes we go come look at the lab side of those of the severe malaria. But as we dey always dey talk, some of all those things not really matter to you. So I think this few one when I just talk is enough for us, because other part will now dey go and the lab aspect. So if person not can do the right thing, not can take care of himself, when all these symptoms will they happen, the last symptom will come be death. The person fit kpai, fit your kpai, your comot for this life, because when the blood don finish, don dey dry, e don get anemia, e don get convulsion, e don affect the brain to the ex ten t say the person go come dey do like say something don dey worry am, or even sometimes e fit even dey unconscious. You dey unconscious. And the temperature when you touch am, im body don dey hot, e fit even burn somebody wey dey close to am. Then you know say, oh,
They don't attack Dr. Israel. The network don't disappear. Oh yeah, everybody. Okay, Dr. Israel is back. Let's bring him up again. You can see the challenge, right? It's not easy. So, Dr. Israel, please continue. Continue.
yeah. I never know where the thing forgot me now because I thought I was I was talking. So as I was saying, I say when you don't notice say you don't the person body don't the hot well. So the essence say if even one person when they close to am, blood don't reduce. When you look in eye, in palm, all of them go be white. And
Right.
that is anemia. It means say blood don't reduce. So when all those things will come make the heart, not the feel pump blood, where the heart will going to beat faster. And anemic heart failure. So many children fit even come down with that one, anemic
Mhm.
heart failure. So the best thing, if all these things are not taken care of, the last symptom will come be say the person go your kpai, and the
Yeah.
person go kpai. We don't see children wey kpai because of severe malaria, because they
Yes, bro. Oh, network. Oh, network. Network. We don't see children wake by because of malaria. That is why e no go good make you dey call am na ordinary malaria. It's not ordinary o. Malaria can kpai people. And I believe that you don't hear wetin Dr. Israel talk. So as Dr. Israel dey try to come back because of the network, we dey talk about malaria, myth and facts. How do we know? How we go take know say, okay, what you have is malaria and not appendicitis. What you have is malaria and not rheumatic fever. What you have is malaria and not gastroenteritis. What you have is malaria and not hepatitis. How will they take no? Number one, you go speak with your doctor. You go follow your doctor talk, because your doctor go ask you a lot of questions to arrive at a diagnosis. You go first of all speak with your doctor. Okay, Dr. Israel is back. Dr. Israel, you don't come back. Okay,
yes, I don't come
welcome.
back. I never even know
Yes,
as I
yes,
take
yes,
the
welcome.
comot
So
sef.
now your network, no vex. God pass the network. Now we're talking about how to arrive at a diagnosis. How do we know that this is malaria and this is not something else? Because our people believe, say, the moment you get fever, headache, and joint pain is malaria. Now, when you go to the hospital and your doctor say, may we check malaria, the reason is because malaria is very, very common. It is endemic. Endemic means that they live with us. It always dey our environment. There are other sicknesses that are not endemic. So when you speak with your doctor, you go wan confirm, is this malaria? Okay. At the same time, you go dey think about other things too that might give you same symptom. I know why I'm saying this, because people go talk say, doctor, anytime wey I go hospital na malaria be the first thing. Why be say dem no dey check other things? They are checking first because that is very common in our environment first. But when dem check you and there is no malaria, then they also go to other things to check. But the first thing is that you must speak with your doctor, and then they'll come do test for you. Different types of tests. Very commonly, na blood they go collect to look your blood whether the parasite dey inside the blood. To look. That is number one, what we call the thick and thin film. Go look, one check. But because of where we dey, wey still dey develop, our people and our government, their head dey shake. They no ready to invest in healthcare. People come do research say, how can we ensure that many people can test for malaria quickly? They come bring another one, wetin we dey call the rapid diagnostic test kit. They go just collect small blood, put am to check. But for where things dey work, where dem don invest, where the government get sense, no be people wey their brain dey skip, they have invested in healthcare. But because of where we dey, we come dey do the rapid diagnostic test kit so that we go fit know quick 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 whether you get am or you no get am. And then there are some other things wey we go come check, like whether you don carry your blood go down, whether you don get anemia, whether e don affect the kidneys and many other things. These are some of the things we also want to check. So make I hand over to Dr. Israel, and then we'll come talk about how do we treat malaria. Remember, we no go give you medicine for here oh. If you are listening to us and you are having any of those symptoms, you have to go to the hospital. We are not going to give you any medicine on this platform. You understand? But how wetin we dey do for patients to help them manage their malaria? Dr. Israel, over to you.
Okay. Now, it is very good for us to know, say, before you even say this person get malaria, you suppose do test, malaria test. And that test now go really say, yes, this
Oh
person get
yes.
malaria. You know they hear me?
Go ahead, don't worry. Continue. People for YouTube and Facebook they hear you. Continue.
Okay, okay. So as I was saying is that before you can actually say this person get malaria, you need to do test. Now, when you do that, not because as Dr. Fred talk, those symptoms they everywhere. Every other thing can actually get that symptoms. But now, when you do test, the test will come show positive. Then, or come tell us how many counts the person get. That's when you can actually say this person gets malaria. So when you don't know say this person get malaria, then you need to treat this malaria. Now, over the years, we get different medications wey we don use take dey treat malaria dey come. But as we dey grow in this life and as we dey grow for medical world and we dey know many research, we come see say some of dis medication dey affect more than dem dey treat. We come see say some of the side effect are not also very interesting. Side effect like your body dey inch you, you go dey scratch body, you go even dey scratch inside your ear. So side effect like whistle go dey blow for your ear like say you wan deaf. So and some of dis medication sef no come still too dey safe for pregnant women. Some of the adjuvants wey you go fit add to take treat malaria. So because of that, we need to really studies continue before we come find out say oh we still get some other medications that we can use to treat. That's the artisan the ACT combination. Yeah, that's how na there I fit talk am reach. The ACT combination. So that combination get different pikin inside, different lineup when you go fit take treat malaria. But you need to meet your doctor. Now the doctor go come know which of them go dey okay for you. And sometimes based on side effect, dem fit not give you some, dem fit still give you some type of it. And if you treat malaria very well, sometimes you don't even need anything to reduce your temperature. With the treatment of malaria, if you really take your drug very well, even the temperature will go down. Because as you dey treat yourself, as the malaria dey go, your temperature suppose dey go. E suppose be the root and the wetin we go take dey monitor say yes, this treatment dey go well. However, if e don dey if na children dis thing dey affect, apart from say we go give medication, for children if their body dey hot, get wetin we dey call tepis-sponge. Get wetin we dey call tepis-sponge. Mothers no even you can do it for adult as well sef. You go put the cloth for inside warm water, not very cold, not very hot, then use am take clean the body. Dat one go help reduce the temperature. Dat one go help reduce the temperature. So
Na
other
so.
things other things wey we go treat na based on wetin we dey see for dat person body. If e blood don go down well well, we go wan give am blood so dat make e
Mm.
fit help am well. If we see say e no dey. And another thing is that most of the time, people wey get malaria, dem fit no like to eat as at that time. Their mouth dey bitter, everything dey do dem, dem no wan eat as at that time. Another way wey we fit take know say yes, this person don dey well, na the person go come start to dey eat small small. So one thing you should do is that
Mm.
the people dey talk say you no fit take this drug for empty stomach, you no fit drink this drug, first go chop before you come take medication. Anti-malaria no really be like that. Studies have even shown say anti-malaria work better on empty stomach. So even though the person no dey fit eat, you go fit still give am a medication, that anti-malaria medication. When you give am the medication, but try make sure say as before that day end, make you eat something, because nutrition is also very very important. Food dey very very important in every treatment, because when you get good nutrition, that one go help to reduce, to increase immune system, because once the immune system increase, e go still join fight any infection wey dey this person body. So apart from the anti-malaria, we go give other medication based on anything wey we see for this person body. Note, malaria and typhoid, they not be brothers and sisters, so they must not go together. So all those get malaria and typhoid, well, I don't want to go there. But just know, say malaria and typhoid is not compulsory that they must go together. And one thing you should also know, that malaria can cause stomach pain as well. Can give some people stomach pain, that the pain go be dey too much, that they no go even fit uh, do so many things. Dr. Fred.
So Israel, how far? They hear me now?
Yes, I can hear you.
Yeah. So the network they show me shege so bad and power. Thank you so much. I know you don't talk about the treatment. Talk about how the symptoms go disappear when the person start treatment. Talk about malaria and typhoid. Wow, people they always talk about. Now we get some questions here, so may we take them because we get other things to talk about. But may we take some comments. So if you get questions, you get comments, ask us, and also we go try to respond to you. Exactly. Take care of the parasite, and the temperature will disappear. Yes, that is true. Now somebody is asking us. It says, can someone's genotype can someone's genotype have anything to do with malaria, especially AA? While AS do not have malaria like AA. Okay. So the answer is yes. But let me say something here. For the fact that you are AA, no mean say you supposed to dey sick every time with malaria. If you do wetin you supposed to do, you no supposed to get malaria. There are many AA wey no get malaria for years. So this whole idea, because you are AA, I supposed to dey sick malaria every month, is not right. It is abnormal. But when you put AA and AS together and mosquito bite the both of them, the AA is most likely to come down with malaria. Because you are AA no mean say you suppose to dey sick malaria every time. It means that there is something wrong with you, whether na your environment or you no dey take care of yourself. But if AA and AS dey together and mosquito bite the both of them, AA will come down with malaria faster than AS. Why? The AA blood, the A hemoglobin, is very conducive for the malaria to grow, the parasite to grow and develop. I'm trying to break it down for you. But for AS, the S hemoglobin there, that S, when mosquito bite somebody and the parasite enter the S hemoglobin, e no go dey conducive, e go break down quickly. E no go allow the mosquito sit down, develop fast. But because the A genotype is said to be the normal genotype, everything wey the malaria, mosquito parasite, plasmodium, e need to develop, the A get am, e go just dey. So e go fit grow well and then cause problem. That is how it is. But no be say because you be AA, then you must dey get malaria every month. No. Is that okay? I don't know if Dr. Israel wan add anything to that. Then we continue.
Okay, the only thing when I go add now, make we the more for this explanation when Dr. Fred just give is correct, but more look at this way. If you see food way good and food way not good, which of them you go like eat? Shey na food way good, na so that parasite still be. E go prefer to go for where e go quick e go fit grow pass where e no go fit quick grow. So I think wetin I just talk so, e really explain that AAAS whatever. So that one and that for that. Now just that one I want to put. Dr. Fred.
Yeah, thank you very much, Dr. Israel, for that. Let's take one more question, and then we'll talk about some stuff again. Somebody they ask us, Gloria, they ask, how many times do we need to treat malaria in a year? Should it be every month? Should it be every 2 months? Should it be every 3 months? How many times in a year should somebody treat malaria? Dr. Israel, over to you.
In as much that you go do tests and you see say you get malaria, you suppose treat that malaria. And wetin go fit carry you go do test na when you get symptoms. So when you have symptoms, you test the malaria and it's showing positive, you need to treat am. Whether na yesterday you first treat am o, whether na today you come treat am o, e no matter. Dis one because we still never get vaccine for malaria. Oh, okay, sorry. With the vaccine wey we get for malaria never really circulate for everywhere. Everybody never really get that vaccine for for malaria. So that is the reason why if malaria enter your body now and you take medication, that medication wey you take na for that malaria, that particular one wey enter your body, e no go prevent the next one wey dey come to enter. So when the next one enter and you come still get symptom, you need to treat that one as well. So every time when you get symptom, say you come dey sick, your body dey hot, and you no fit stand, your leg, your joint dey pain you, your head wan fall, you need to treat that malaria. And you can't go do test, e come be positive, you need to treat that malaria again. So it doesn't really have a specific time. E no mean say na every month, e no mean say na every 2 years. E just mean according to how your immune system fit take protect you. So if your immune system, that's why as we dey talk about treating of malaria, you also need to think about boosting your immune system by taking a lot of water, eating good food, eating vegetable, a lot of fruit and all that. Boosting your immune system, doing exercise, try to rest from severe stress and all that. When you do all those things, your immune system dey high. Even when the malaria enter your body, e no go get power take do you anything because your immune system would have wall it off, would have fought it off before anything go happen. But if those malarias enter your body and you come dey get symptom, you come dey sick, abeg go treat am. E no matter how many times in a year, you just have to treat it. Dr. Fred.
Okay.
Dr. Fred.
Alpha, can you
Yeah,
hear me now?
yeah, I can hear you.
Okay, okay. So I don't know if my network is messing me up so bad. Now there is something again I see. This question, let's talk about some myth. Doctor, I never treat malaria for 1 year, 2 years, 3 years. I never treat malaria. I beg. I won't take malaria medicine. Doctor, I hear say I must treat malaria. I hope you don't address that one because I know here my network does the mess up, you understand? So if you no get malaria, you no treat. I know Dr. Israel talk something about as long as you get them, you treat them. You don't need to treat, you don't need to take medicine. Here you get. Now, if you dey watch me and you never share the live session so that more people go come learn. Share. Huh? And then ask us some questions on malaria. We go try respond to you. So how can we prevent malaria? Wetin you fit do to make sure say you no get malaria? Because a lot of people dey talk about I dey always treat malaria. Why? It's abnormal to dey treat malaria every time. E no good. E no dey normal to dey treat malaria every time. You are not supposed to be proud of it. Say January I treat malaria, February I treat malaria, March, April, May. It means there is something wrong somewhere. And what you are supposed to do na to find out wetin dey make me dey treat malaria every month. Number one,
Okay, so now to find out what they make you they treat malaria every time. So when you address those things, when they make you treat malaria every time,
Network, mosquito must bite
then
you
you no go dey
because
treat
network is shaggy
malaria
shaggy.
as
Hmm? Uh-huh.
so you no go dey treat. Continue.
Make I allow Dr. Israel continue because the network is frustrating. Dr. Israel,
Okay, okay. So you no go dey treat malaria again.
I don't know
If
if you dey hear me.
I dey hear you, I dey hear you, I dey
Dr.
hear
Israel,
you, I
please
dey hear
continue,
you.
continue, continue. I beg.
So as I was saying, if you know those things where they actually cause why you they get this malaria, and you can't take care of those things, then you no go dey treat malaria often and often. Remember the first thing when we talk, I tell you say yes, as many times as malaria affects you, you need to treat them. Down and truth. But it's not normal that malaria is supposed to dey affect you every time. So that's why you need to know what if these things when they happen, when they make malaria, they affect me all the time. One thing you should need to know also is that cleanliness, like they say, is next to godliness. What I'll see this one means that cleanliness is waiting go fit drive away a lot of sickness away from our body. And malaria are part of those sickness when we go fit drive away from our body with cleanliness. So your compound should be clean. There's no need to be all those places, all those small, small places where you gather, where water they gather. Because anywhere where water they gather, whether na clean water, dirty water, when you they gather, where they gather, that stagnant water. Na good place where mosquito dey breed, where mosquito dey lay egg, where mosquito dey grow. And you remember saying that dem dey carry the parasite wey dey cause malaria. So what e mean say your compound need to dey clean, e need to dey free from any stagnant water. And another thing is that if bush dey around you, you need to clear those bush far, because all those bush na still place wey mosquito dey fit stay. Then when we come inside our house, some people their clothes go just jump pack for one place. If you hit the clothes, mosquito go fly come out. Or things wey you no dey use again, you go pack am put for one place, pack am. I no know who you dey keep am for. When you hit those places, you see say insect, mosquitoes go fly come out. Wetin that one mean is that let those things wey you no dey use again, comot them from your house. If the one dey wey you go fit dash person, dash person. If you no go fit dash person, dispose them. Dispose them, make your room, your house dey free. Because if your house dey free, they no go dey get room for all this mosquito, all this insect, all this rodent go dey see where hide. So cleanliness is very, very important. Removing of dirt away from your compound, and making sure that your where you dey no water wey dey stagnant not too dey. Your inside house, you no get many, many things wey gather for different place wey you no dey use. When be say if you touch the place, mosquito go dey fly come out, because those places na where dem dey go rest and dey get ready to fight. Another one, your room, your door and your window should have net. Must have mosquito, we have net. Then you suppose to dey lock your door very well. And then another one I be say you also need to dey sleep under insecticide treated net. Insecticide treated net, so that when those insects, mosquito touch the net, they go just die. Not be say they go touch the net, they go fly comot. No, they go touch the net, they go die. um Then if you sit down for outside, and maybe in the night you sit down, you decide to sit down for outside in the night, e go dey very good as well. Make you wear long sleeve, make you wear cloth wey go cover most part of your body when mosquito go fit enter come take bite you. Then we no go stop all these things without we no talk about the food wey you dey eat. You need to eat good food. Eat good food, well prepared meal. Apart from that, you need to eat fruits, vegetables, drink a lot of water, because all this one will help your immune system to grow, to improve. And as you dey eat all this one, there's no we no go fit stop without we not talk say reduce stress. We know say the country dey stressful already, but in your own way, try reduce stress. And also dey do exercise. So all this one when I dey talk na to boost to improve your immune system. Because once your immune system dey improved, eh, Once you don improve your immune system, all dis even though the malaria enter your body, e no go give you problem at all because your immune system go just suffer carry am, just pocket am, just remove am comot from your body. So these many things wey I don talk make I just re-talk am. Make sure say water wey dey one place, stagnant water, you no dey your side. Make sure say grasses, bush no dey close to you. Your bush dey very far. Your compound dey very clean. Make sure say your room, your door and your windows get net. Also dey lock your door. Another one, dey sleep for insecticide treated net. Another one, pack all the dustbin, all the dirty, all those things wey you think say na good things but na dirty for your house. All those things wey you don keep, wey you don hide for one place, wey you no dey use, wey you suppose don dash somebody but you no gree dash. All those things, pack am comot for your house because there be room where mosquito fit go stay, go dey relax, dey wait for you to handle you. And also if you sit down for outside, try wear cloth wey go cover all part of your body so dat mosquito no go see time take hit you. And the last one, I come talk say make you eat good food. Eat food that contain a lot of vegetables, take a lot of fruit, drink a lot of water. I say you no fit do without, you no rest from stress, because all those go help to improve your immune system. And exercise is also very, very important. Dr. Fred, over to you.
Dr. Israel, can you hear me
I
now?
I can hear you. Continue.
You can hear
I
me?
can.
Okay, thank you very much. Because I dey struggle to hear you, and I know say you don't do justice. You understand? I believe your government so well. But before I come,
Abeg o, this network decided to finish Dr. Fred today o. E decide say Dr. Fred no go just dey this live session. So please, if you have any question, please drop your question. Okay, Dr. Fred, you are back.
network don't show me shege o. Shey
Network,
people they see the stress where we dey go through, the challenge of network. And that one somebody go still come dey tell me say I know the answer in question, I know the respond to am. You can see what we go through, right? Okay, good. So may we take some questions here and let's see. But this person came late. Ah, Dr. Israel, he said, please, I
I,
want to know. Apart from mosquito, e get another thing wey dey give person malaria. Dr. Israel.
okay. We don't talk how malaria fit take affect person. Now, mosquito na im dey carry the parasite when they give malaria. So not be saying that mosquito they give us malaria. E dey carry the parasite when they give malaria. And the parasite is called Plasmodium species. This Plasmodium species get four members wey dey quick cause malaria. We mentioned their names before, so you need to watch the full video. Plasmodium ovale, Plasmodium falciparum, Plasmodium malariae, and Plasmodium vivax. So those one na how malaria take dey affect person. Another thing wey be say person fit take quick get malaria even when mosquito no bite person na when this parasite don enter inside the body of person, some of them go stay the liver and go dey relax for the liver. They no go
Mm-hmm.
cause problem at
Tell
first.
them.
So when the first set don come out, don cause problem, you don treat that one go. That one wey dey the liver, if your immune system reduce, that one wey dey the liver go come burn, come outside, come cause problem. So even when mosquito no bite you, but because of that one wey dey inside the liver, you fit still come down with malaria. Hope I was not able to answer your question as you want.
Yeah, thank you so much, Dr. Israel. So we don't talk about how to prevent malaria and some other stuff. But you get one thing where I want to talk about. I don't know whether we talk about now pregnant woman. If you notice, when woman get belle, we know they want make the woman get malaria. Because malaria for pregnancy, if it affect the woman and if it affect the pikin for belle, if it affect the two of them together, or if it affect one person, if it make the woman blood short, she will get anemia. At least her blood go down. The woman sef, she no come dey chop food how she suppose to chop food. And remember, dis woman need to eat food well wey go also help her weight, her pikin. Dis malaria fit affect the pikin for belle. E fit make the pikin small, the pikin go come get low weight. When she born the pikin, the birth weight go dey very low. The birth weight go dey very low when she born. Sometimes e fit make dis woman get miscarriage, she fit lose the pikin for belle. Yes, malaria fit cause am. Sometimes e fit make the woman, when the woman come born pikin, she fit born the pikin before the time. Time never reach for the woman to born pikin. The woman fit born preterm delivery, preterm labour fit make am. Some women fit come born pikin, as dem born the pikin no go dey alive, pikin go kpai. So malaria in pregnancy na something wey we no dey joke with. That is why if you are a woman and you are pregnant, it is important, number one, say you register for an ten atal. Number two, you follow the advice wey dem give you. Number three, you take the medicine wey dem give you to protect malaria. Number four, when your body do you anyhow, you let dem know say see, dem go check you. And if na malaria, take the medicine for am. Na dis one be the small thing wey I wan add. Dr. Israel, any other thing to add as we prepare to round up tonight?
Okay, and Dr. Fred, what you just talked, so it dey very, very important. That part in the treatment of malaria for pregnant women, it dey very, very important. So that's thank you so much for that. Okay, Dr. Fred talks some misconception about malaria. So one thing when I want to talk, when you say I never treat malaria for a very long time, so I need to treat malaria. We don't tell you, say the only way when you fit treat malaria now when you get symptoms, you do test and the test show positive, then you go treat malaria. So there are sometimes you go say you want to do your general checkup and you just do the test and they say malaria 1+. You not get symptoms, nothing they do you, you are good. Nothing they do you, you are good. You don't need to treat malaria. The reason because mostly when they use, say the test that they could use now, this RODT, eh? Uh, the one where you chook your hand and small blood will come and they go you most of the time for Nigeria. Eh? Yes, that's point of care testing. Hmm? Now, when they do all those ones and they come out positive or so, you really don't need to treat malaria at that time because you may not even have malaria. And this is because with Dr. Tokan, malaria is an endemic disease. It's an endemic problem in a lot of middle and low income countries, and Nigeria is part of it. So when you don't have any symptoms, but you just see that test dey positive, not stress yourself, go dey treat malaria, go dey take many medication. Just increase your immune system and you'll be fine. And so please, make we always dey try to speak with our doctor. Most of us don't abuse anti-malaria like say because anti-malaria you can actually get it to buy everywhere. But the best thing, the right thing we should have done is even when you get malaria, go hospital. They go they go check first, then before they go give you medication to take treat the malaria. So I believe say we don't talk a lot of things about malaria. And the reason why we take malaria as topic today just because a few days ago was World Malaria Day. And so we also they try to make sure to tell people, and those of us when they watch for different part of the country or different part of the world to remind you say hey, malaria still do, malaria can still be deadly. More no underrate malaria. Yes, there are some country where malaria not dey. Some person I see one question when say whether malaria dey US or UK. Yes, there are some countries where malaria not dey. Because of their weather condition and all that, it prevent those malaria from entering those countries. However, those people still dey at risk of getting malaria because the day they will travel comot from there come countries where malaria dey and they don't take every prevention they're supposed to take. If malaria all those kind of people because they don't get that antibody, we go feel first say, oh yeah, I know say this one they come, make I deck am. Because they don't get all those kind of stuff. Their own malaria they always dey severe. It dey always dey very, very severe. So please let's try to manage ourselves let's try to eat good food. Let's try to know what to do at the right time. Let's take care of our pregnant women so that may they not come down with malaria. Let's take care of our children of under 5 years. Once you notice anything about them, please take them to the hospital. Not do self medication, and not do self medication, because you can just be putting that child in a big shit because you dey do self medication. Now, make we just do a little recap of wetin we don talk since about malaria. So, first thing when we talk, we say malaria na parasitic infection. So, it's caused by a parasite, and e dey endemic for this part of the world, Nigeria and many of Africa country. We say e dey endemic for middle and low income countries. Middle and low income countries. Most of them get malaria, and e dey caused by plasmodium family, and na mosquito na im dey carry am. And not just all mosquito, but na the female anopheles mosquito na im dey carry dis malaria. And when dis malaria enter person body, dis malaria fit decide to cut itself into two. One part go dey inside the liver dey rest, while one part go pass through the liver come outside to the blood dey cause problem. And what kind of problem you fit cause? You come give you symptoms. Symptoms like your body go dey hot when we dey call fever, your body go dey weak, you fit dey get headache, your joint go dey pain you. Den with the malaise, fatigue, you go dey catch cold. Some pipu go just dey catch only cold, some pipu go dey catch cold and their body go dey shake. So because e cold, call those one chills
Hmm.
and rigor. So e fit go further say the person no go come dey feel heat, and when dis person no dey feel heat, dat can lead to other things. E fit even come go dry the blood of dat person, come dey give the person anemia, and when anemia come, e go fit lead to congestive anemic cardiac failure, say the heart go dey fail. And if the blood still too dry, e fit damage the kidney. Now dis person, the malaria fit enter im brain come cause cerebral malaria. So when e cause cerebral malaria, dis person fit go unconscious, and so many, even convulsion fit happen, and so many many things. So when you notice anything, we say go to your hospital, go to the hospital, see your doctor. E go do test for you, ask you a lot of question, do test for you. If na malaria, e go treat you. E go give you those medication when dey approved for the treatment or for the management of malaria. So e go give you those medication, and e go treat the malaria. Den we come still talk say the way wey you fit take prevent dis malaria from happening all the time. Yes, we fit prevent. Now prevention no mean say e no fit happen oo, but at least you go dey malaria free for a very long time. We come mention say you need to make sure say your house dey clean, remove stagnant water, remove dirty from your compound, grass all those dustbin wey una come heap, remove all of them from the compound. We also come talk say make you dey sleep for under insecticide treated net, make your window and door get net, make you dey lock your door, make you dey eat good food, eat fruit, eat vegetable, drink a lot of water, do exercise, and rest from stress. So when you do all these things, um you just be likely saving yourself from malaria. As I dey talk all this one, I also make I remind you say our time don finish. Dis one na just 1 minute to end this live session. If you never share dis live session, you no dey do well oo. You no do well at all. So try. You never still late. You never late at all. You can still share it. At least if the person watch am as recorded stuff, e not bad. But e for make sense say you share am on time, make the person still come here, come ask us im own questions, then we may from there answer the question, and even you fit even learn one or two things from that person question. Dr. Fred.
Yeah, thank you so much, Dr. Israel, for the wonderful summary where you give. Our time on the live session is over, but if you just dey come, you can watch again from the very beginning to know wetin dey cause malaria, to know the symptoms, how dey take treat am, because somebody dey ask us if na antibiotics. No, not antibiotics. If you get malaria, please speak with your doctor. And then if you never get my course for content creation, I see a lot of people where they follow me on Facebook. you go destroy your page. Listen, you go destroy your page. And I don't want you to spoil your page. Get the course. I know a lot of people talk say, and you want sell course. I'm not begging you. Listen, but you will destroy your page. I don't want to make it look like I define your money. No, but you go destroy your page. I beg you, go and learn so that your page no go destroy. And if you spoil your page, you can't come back on the cry, Dr. Fredostar, this and this happened to my page. No, I don't want that. So there's a course on my page. Look for the link and get it. It will help you. The benefit is much more than the amount. Ehen. And I want to appreciate Dr. Israel for coming. Thank you for covering up for me. Network Show Me Shege. And thank you for watching. We will see you next week Sunday on this same program. Like I always say, good life now waiting. Good life. Na sense. Take care and have a wonderful day. Bye bye.
Bye bye.